Level of acuity, everything from simple fractures, sutures, to strokes and heart attacks.
Our emergency medical service staff is skilled and care about each patient.
I've been with the hospital for 7 years now. Our hospital is Joint Commission accredited. The nursing staff we have in the ER, we all try to have them ACLS and PALS accredited along with BLS. In fact, when I started with the hospital, we were in the emergency room was a little hole in the wall back over on the back side of the hospital, almost a little closet. You turn around, you'd be bumping into the patients. It was so small. Now we have a nice ER spread where we can separate the critical patients from the routine clinic type patients that have simple ailments that can be fixed. Our staff is educated and trained before they're placed back in the emergency room and delivering care.
Out here you see pretty much everything. You see everything from cradle to grave, as we like to say in medicine. Lots of children, lots of peds, and lots of geriatrics. We've got a large number of citizens in this community that are approaching 100 years old, so they require a great deal of care. The nursing home next door is a 60-bed facility, and of course I'm the medical director of the nursing home.
I'm Glenda West, and I'm director of nurses here at Lakeland Villa Convalescent Center. We're the long-term care part of Lanier Health Services. We are a 62-bed facility. We are currently full with a waiting list. I would say that the biggest asset for Lakeland Villa is our staff. Most of our staff lives and works in this community, and that gives it kind of a special effect, I think. I am an RN. I originally grew up here in Lakeland, Georgia, moved away for 30 years and moved back home. Our slogan here at Lakeland Villa is, your family is our family and our home is your home. And I think that that's what makes us special, is that we're caring for our friends' parents, our friends' grandparents, and maybe even our own friends and grandparents, because we live and work in the same community.
We're extremely proud of our rehabilitation department serving our hospital patients, outpatients, and our nursing home residents.
At Lewis Smith Memorial Hospital's rehab department, we offer physical therapy, occupational therapy, and speech therapy. We take care of all populations. We serve the inpatients in the hospital setting as well as swing bed patients. We take care of the nursing home next door, and we also serve the outpatient population. Here at Lanier Health Services, we do really provide quality services with a personal touch, but it means so much more to us. We bring your family member in, and we'll take care of them as if they were our grandmother or our grandfather. We go above and beyond just what is required. We extend our heart to them, and we welcome them in as family, because that's what we are, as a family.
Hi, my name is Melba Bailon. I'm a board-certified nurse practitioner. I work with my husband, Dr. Benjamin Bailon. We've been in this community since '84. We really are in close-knit with the hospital, because most of the hospital's services is related with us. We send patients back and forth from our office to the hospital, and if there need be, they are admitted at that small hospital. So far, there is the need of this small hospital is very vital for our office for this town.
Okay, we also have a sleep disorder center here at Lanier Health Services. We went through a process a couple of years ago with the American Academy of Sleep Medicine, the AASM, and we are accredited. We utilize the Alice 5 systems. We have 2 portable systems that are laptop-based, and these are cutting edge.
Our Sleep Disorder Center is accredited through the American Academy of Sleep Medicine. We utilize the latest tools and technology.
Alice 5 equipment is the latest equipment that is out. It's a Respironics product, and it is providing very, very high-quality information to our physicians whenever they're diagnosing sleep disorders. Hello, my name is Bill Wilson. I am the Quality Improvement Risk Manager here at Lanier Health Services. I'm also the Director of Ancillary Services. In small rural hospitals, we all wear multiple hats, and this very exciting, makes this job very exciting, because it gives us opportunity to be involved in a lot of different projects in a lot of different areas of the hospital. You know, when patients come to our hospitals, one of the major things that patients in hospitals will fuss about or complain about is the quality of food. And we recently have contracted with Morrison's cafeteria to take over our food service. They're doing a really good job. They feed the employees through the cafeteria, our patients at the hospital, and our residents in long-term care. Mr. Gus Walters is our nutritional director over there, and he's doing a really good job for us. The past year, we've had some really important projects that involved technology, and you've probably heard this from our radiology director already about our teleradiology PACS system, which allows us to take X-ray images in a digital format and send them via a T1 telephone line to a radiology group that's remote from our hospital, and then we get results back in a very quick time. This, we feel, has vastly improved the care that we provide to our patients because we have results back quickly, and that patient can be treated in a very timely, efficient manner. Prior to Telerad, we had some very extensive delays in getting those reports back, so we're real proud of that. And we've been honored by the Georgia Hospital Association and Partnership for Health and Accountability by being awarded the Critical Access Hospital Patient Safety Improvement Award for 2006. We're currently redesigning our hospital for patient safety. We're experiencing a different type of patient from what we originally were set up for. We have swing bed here, which is an intermediate care level between acute and long-term care, and we're finding that we need to adapt to that type of patient. We're also finding that we're receiving quite a few bariatric patients, so we're redesigning. We have walls going down and walls going up. We're making new shower arrangements so we can accommodate these folks a little bit better. We're getting beds that will accommodate very heavyweight patients. We bought lifting devices to assist us to preserve our employees' backs and, of course, to protect our patients as well and allow us to handle them more effectively and more efficiently. So even though we're a small hospital, we feel like we are technologically advanced in a lot of ways. Our laboratory, as the director will tell you, we have very new equipment in there. We do a lot of studies in-house, and then we have a reference lab, of course, remote from us, that we send those things that we don't perform here. But our laboratory is quite advanced. Our rehab is second to none. We do physical therapy, occupational therapy, and speech. And this service has really advanced over the last year. Radiology, pharmacy, we're right now looking at starting an in-house long-term care pharmacy so we can supply drugs to our long-term care residents. We're going through the licensing process for that right now. So anyway, we feel like we're making a lot of progress here, and we are always conscious of providing the best care that we can to our patients, and certainly doing it with a personal touch, which is the forte that we feel we have here at Lanier Health Services.
Lewis Smith Memorial Hospital is owned and operated by Lanier Health Services, an affiliate of South Georgia Medical Center. It's been our pleasure to show off a small portion of the wonders of technology at our healthcare facility, and yet we find it so very difficult to capture the heartbeat of our caring, compassionate, professional healthcare family. Perhaps someday you'll have the opportunity to visit Lewis Smith Memorial Hospital and experience firsthand our people. After all, they are the ones that place the personal touch in our healthcare services.